The last question I want to ask also is about kidneys. Does protein or heavy protein diet affect the kidneys?
Um, yeah, often in a beneficial way, to be honest. I mean, there's data out there. I mean, my friend David Unwin in the UK has shown in his population of chronic kidney disease, diabetics with chronic kidney disease, that a higher protein diet actually reverses that. There is a misconception that higher protein diet damages kidneys based upon something called the Brenner hypothesis. This is Dr. Brenner from the 1980s, I believe, showed that in animals, particularly rodents, mice and rats, that high protein diets actually cause glomerular damage, and that was associated with kidney disease. And we do know that when humans do go into kidney failure, they will spill more protein, and so we associate protein as being stressful to the kidneys or being associated with kidney disease. However, it's not the protein that's causing the damage. It's often diabetes is probably the number one cause. Prediabetes, insulin resistance, is probably the number one reason for kidney failure. So higher protein diets, I mean, one of the thoughts is it causes more sort of hyperfiltration and stress going on in the kidney, which there is some truth to that. But it's kind of like the analogy that exercise makes my muscles get bigger. And that, is that bad? Is that stress? Is that eustress? We know that, like, for instance, pregnant women, their kidneys get bigger. We know this if you have a nephrectomy and you lose one of your kidneys, your other kidney will have compensatory enlargement. And so when your kidneys deal with higher protein, they make it bigger. And you know, I don't think that's a problem. In fact, what we see in old people as they shrivel up and die and they become anorexic and cachectic and sarcopenic and their brain shrinks, all their organs shrink down. That's a sign of impending death. So having big plump organs is not necessarily a problem. I mean, there are some exceptions. There's a tumor or something like that, or large livers for some reason if they're very fatty. But it's not generally the issue. I mean, I think Stu Phillips has a wonderful paper in 2018 looking at a huge systematic review of higher protein diets versus lower protein diets. And this is in healthy people, no effect on negatively with kidney damage. Jose Antonio has done studies on guys that are, bodybuilder types that were consuming massive amounts of protein. We're talking 3, 4, 5 grams per kilogram of body weight of protein with no evidence of renal damage, liver damage.